Hi guys, I hope your morning surgery's gone okay. Look, there have been lots of government announcements over the weekend and this morning, including resourcing GPs to deliver advice and guidance at £20 per episode to be able to sort out clinical issues that might not end up needing a referral to help mitigate the elective recovery programme. We've got 1 in 9 of the population sat languishing on a waiting list for specialist intervention. And don't we know it? Stopping advice and guidance is one of the items on our collective action menu, so you've probably been wondering how the government announcements over the weekend would fit into that plan. I made reference to this potential idea at England's LMC conference back in November and again after the government announcements just before Christmas. General practice is open for business. Yes, we are taking part in collective action, but that is because we are now closed to being taken for granted. We've added advice and guidance onto our menu because it's unresourced workload transfer. Now, if it is successfully negotiated into the 25-26 contract and resourced, then of course it could be dropped from the menu. I'm sure you'd all much prefer to see investment going into uplifting our core contracts, but again, as I explained to LMC conference, Treasury are not going to increase the funding to core when we are doing more work than ever before with record levels of low funding. As long as we continue to do more for free, nothing will change. Now, in terms of how this is commissioned, we need to be careful in the nuance that separates the difference in being able to request an investigation, interpret the results and manage our patient, and any expectation of doing that. If it's within our generalist skill set and it will lead to much speedier consultant access, all the better. But this is not for having a go at something uncommon, complex or risky. It's been fascinating to have the postcode lottery of what we as GPs can access have a light shone upon it. We need clarity around what funding trusts get for advice and guidance, because we're going to need a fair distribution of that resource to be commensurate with the medical legal risk, patient interaction, complaint management and work. But if we are paid fairly, this is exactly what we have been asking for, and it's a positive step. And just because some situations may not warrant this, it shouldn't mean we refuse the opportunity to deliver and get paid for any such situation, which may well be appropriate. And I hope this is the beginning of NHS England and ICBs starting to make sensible decisions about where it's best to invest rather than the open chequebook to the acute sector. And it's the first example of this government's commitment, as they've promised, to shift activity and resource outside of the acutes. But as ever, nothing's agreed until everything is agreed, so we look forward to seeing the detail behind all of these announcements. Have a good afternoon.